Hey guys, spinal health class. We're going to be using chairs with this. So we're going to need at least 2 chairs, some yoga blocks, about 4 yoga blocks. We're going to do some spinal segmentation work, and we're going to do some PAILs and rails. We want to get individual control of flexion and extension in each and every vertebra. This is the foundation of spinal health. It's going to open up other ranges of function and range of motion in rotation and lateral flexion. Remember, start off with low intensity, especially if you're new to functional range conditioning, and we're building up over time. Okay, let's get into the foundational movement for these spinal health exercises, and that is flexion and extension of our lumbar spine. We do that by anterior and posterior pelvic tilt. So get on the edge of your chair, start off in anterior pelvic tilt, chest up, extending back, looking straight ahead and up. And now what we want to do is go into posterior pelvic tilt, spinal flexion, as far as we can, slow and controlled, and then go into anterior pelvic tilt. If you're having trouble coordinating this movement, because sometimes people haven't moved this well or haven't moved well through this area for a long period of time, just get a band, place that band around the base of your lumbar spine so it creates another neural input for you to gently push into. So try and really focus on your lumbar spine here. I don't mind if the thoracic spine comes along to the right a little bit, but try and really focus that lumbar spine. So we want to do at least 12 reps here, slow and controlled. So if you need the band, do the band, but keep going. So extension. Let's do another 6 reps. 1, 2, don't go into any sharpness, just back off from any pain and just go into the movement that you have ownership over. Another 2 reps, and last one, slow and controlled. Great. Okay, let's start off with a warm-up. What we're going to do is be in that spinal flex position. We're going to use our blocks and our 2 chairs to be able to get into flexion and to posterior pelvic tilt. Once we're in there, we're just going to do some breath work. So we're going to breathe in 6 seconds, breathe out 6 seconds, and we want to expand the rib cage when we're doing this. So really trying to expand that rib cage as we breathe in and out. Okay, so just get into this position. We want to go into posterior pelvic tilt. We're getting into spinal flexion. Now what we're going to do is bring our sternum to our belly button so that we're flexing that thoracic spine, and we're going to be looking down towards the floor. Now just making sure that you're really just getting a general flexion stretch there. You may need to change the height of the yoga blocks as you go down into this flexion. So find an area where you can get a general spinal flexion there. Once we're there, I want you to breathe in 6 seconds, expanding the rib cage. Breathe all the way out 6 seconds through your nose. Breathe in 6 seconds. Expand the rib cage, breathe out 6 seconds. Breathe in 6 seconds. Breathe out 6 seconds. One more, breathe in 6 seconds. Breathe out 6 seconds. Great, now let's go into spinal extension, doing the same thing. How we do that is we're going into anterior pelvic tilt this time. Again, we're going to bring our chest up and forward, head looking up towards the ceiling. Get into a general extension there, making sure that you're bringing that chest up so you can feel that extension of that thoracic spine. And again, breathe in 6 seconds. expand that rib cage, breathe out 6 seconds through your nose. Breathe in 6 seconds. Breathe out 6 seconds. Breathe in 6 seconds. Breathe out 6 seconds. Breathe in 6 seconds. Breathe out 6 seconds. Great. Okay, guys, we're going to do a PAILs contraction in flexion and extension. What we want to do is get in our spinal flexion position. So the way that we do that is we go into posterior pelvic tilt. We're tucking the tailbone under. Once we've done that, our lumbar spine's flexed, then we bring our sternum to our belly button, we flex down our thoracic spine, and then we look down and we're in this flex position. Now our PAILs contraction is going to be pushing our legs down into the ground. While we're holding here, we're going to be resisting up with our hands. So the contraction is going to look like this, okay? And that's our PAILs contraction. All right, so let's start off our timer. We're going into that flexion through our lumbar spine, thoracic spine, and cervical spine, looking down towards the floor. Just get a general good flexion stretch throughout the whole spine. And what we want you to do in another 15 seconds, I'm going to get you to push down with your legs and knees and up with your hands. So 3, 2, 1, go and contract. You'll feel your abdominal muscles and core switching on. 5 seconds. 3, 2, 1, stay in that flex position. Hold that stretch, making sure that you're getting a good general spinal flexion. Great. 3, 2, 1, contract again. Pushing down with your legs into the floor, up with your hands. Your hands are behind your knees, so you're getting that resistance. 3, 2, 1, stay in that position. Last contraction. Great. 3, 2, 1, pushing. Just a gentle intensity at the start. Another 5 seconds. 3, 2, 1. Brilliant. Just slowly coming out of that base. Okay, so spinal extension, PAILs contraction. What we're going to do is get into extension of our lumbar spine, anterior pelvic tilt, bringing our tailbone back. We're going to then bring our sternum up, extending and looking up. This will be the position. Our PAILs contraction is going to be pushing our knees into our hands, okay? So we're going to be doing this movement with our knees and then pushing our hands down towards the floor. Okay, let's start our timer. Let's get into that extension and looking up. Okay, I'm going to count you in 5 seconds and we'll do the contraction. 3, 2, 1. Pushing up with your knees, down with your hands, contract. Staying in that extended position. Okay, 3, 2, 1, relax, stay in extension. Where can you get to? Are you getting a general extension throughout the whole spine? Okay, contraction in 5 seconds. 3, 2, 1, pushing up with your knees, down with your hands, contract. Keep contracting. Good. 5, 4, 3, 2, 1. And relax, stay in that extension. Last contraction. chest up, anterior pelvic tilt. Okay, 3, 2, 1, pushing down with your hands, up with your knees, up towards the ceiling, contract. 3, 2, 1, and slowly coming out of this base. Okay, let's focus on our lumbar spine. We want to get into flexion. How we isolate this is we just bring our hands down, holding onto the edge of the chair here. Now we go into flexion. That means we want to go into posterior pelvic tilt, okay? And trying to get that flexed position just in that lumbar spine. Now our PAILs contraction is going to be pushing my legs down into the ground. I'm going to hold onto this part of the chair here, and I'm going to be trying to lift my hands up off the chair. So let's get the timer on, and we're going to get into that spinal flexion. So let's get into that spinal flexion. We want to go into posterior pelvic tilt. We want to tuck that tailbone under, and we just want to get a good flexion stretch, contraction there. And in 15 seconds, I'll count you in, and we're going to be pushing up with our hands and down with our legs. So 3, 2, 1, we're going to be contracting up with our hands, down with our legs, contract, keep contracting, feel that tension. 3, 2, 1, and relax, staying into that lumbar flexion. Really focusing on that lumbar spine, that posterior pelvic tilt. 5 seconds, I'll count you in again. 3, 2, 1, pushing down with your feet, up with your hands, holding onto that chair. 3, 2, 1, and relax. 15 seconds, stay in that lumbar flexion. Okay, last contraction, 3, 2, 1, pushing down with our legs, up with our hands. Keep going. 5, 4, 3, 2, 1. Okay, we've done our PAILs contraction. Let's get into a rails contraction again. Get into that position of flexion through our lumbar spine. Our contraction for this one is going to be opposite. We were going this way. Now we're going down into the chair with our contraction. Don't worry about our knees and our feet with that contraction. Just switch on your core. So let's get into that spinal flexion. It's really focusing that lumbar spine. And I'll count you in for our contraction in 5 seconds. 3, 2, 1, pushing our hands and elbows down into the chair. Contract. Keep contracting. 5, 4, 3, 2, 1. Just stay in that spinal flexion. Focusing at our lumbar spine. Another 5 seconds and I'll count you in. Okay, 3, 2, 1. Pushing our arms into the chair, our elbows into the chair. Keep going. 5, 4, 3, 2, 1. And stay in that flexion. Last contraction. Okay, counting you in. 3, 2, 1, pushing down into the blocks. Contract your abdominal muscles, pushing your elbows down into the blocks. 3, 2, 1, and slowly coming out of that base. Okay, spinal extension, PAILs contraction. What we're going to do is get into extension first of all. So we're going into anterior pelvic tilt, coming down on our elbows, sternum up, and really just focusing on that extension of that lumbar spine. So just find a comfortable general extension of our lumbar spine. Our PAILs contraction is going to be pushing our elbows and arms down into the chair. So let's get into that position. I'll just get our timer on. Okay, so into that extension, anterior pelvic tilt, lifting that tailbone up and just staying in that extension base. Good, sternum up. It's really important that you don't go in any sharpness or any discomfort with this movement. This can be a sensitive area. So I really want you to just back off that extension if that's the case. Okay, 3, 2, 1, pushing down into the blocks. We're pushing down this way. Elbows into the blocks, contracting. Keep contracting. Keep going. 3, 2, 1. Relax, stay in that extension. Great. 3, 2, 1. Pushing down into the blocks. Contract. Contract. 3, 2, 1, and relax. Just stay in that extension. Last contraction. 3, 2, 1, pushing elbows into the chair. Keep going. 5, 4, 3, 2, 1, and relax, slowly coming out of that base. Okay, rails contraction in extension. The rails contraction is going to be pushing up. We're going to be holding the chair, so we're going to isometric contraction. We can also lightly push our feet into the floor for this one. Okay, so stay in extension. And I'll count you in. Okay, our first contraction, I'll count you in. 3, 2, 1, pushing up with our elbows and hands and pushing down with our feet into the floor. Contract. Keep contracting. 3, 2, 1, relax, stay in that extension base. Okay, counting you in for our contraction. 3, 2, 1, pushing up with our elbows and our hands, down with our feet. Contracting. 5, 4, 3, 2, 1, and relax. Last contraction. Okay, it's counting you in. 3, 2, 1, pushing up with our hands, down with our feet. Contracting. 5, 4, 3, 2, 1, and slowly coming out. Okay, let's focus on the thoracic spine, our PAILs and rails contraction. We're going to start off in flexion. To get the lumbar spine out of it, we want to bring the lumbar spine in extension. We want to get into anterior pelvic tilt, okay? And then what we want to do is bring our sternum to our chest as we then look down towards the floor and try and get that flexion through our thoracic spine. Sometimes it's easy to get our scapula to do the movement, making sure that flexion is in that thoracic spine. So let's get into that position, let's extend that lumbar spine, go into that flexion, bring the sternum towards the belly button and feel that flexion throughout our whole thoracic spine. Okay, let's start the timer. Remember, we're going to bring our hands underneath our knees for this one. Contraction's going to be pushing up and pushing down with our feet. Okay, count you in. 3, 2, 1. Pushing up with our hands, down with our feet. Stay in that flexion of that thoracic spine. 5, 4, 3, 2, 1. Stay in that flexion. Bringing that sternum towards the belly button. Okay, breathe in and irradiate. Getting the next contraction. 3, 2, 1. Pushing our hands up into our knees. Bringing our feet and knees, pushing it down towards the floor. 3, 2, 1. Stay in that flexion. Good. Counting you in for our last contraction. Good. 3, 2, 1. Pushing up into behind our knees, pushing up and down with our feet in our knees. Resisting. 5, 4, 3, 2, 1. Okay, staying in that position. We're going to bring our hands into the front here. And stay into that, bringing the sternum down, making sure that you're getting good flexion to that thoracic spine. Now our rails contraction is going to just be pushing our elbows and our hands down. So I'll count you in. 5, 4, 3, 2, 1. Pushing down with your hands onto your knees, pushing this way. Push and hold, trying to get more flexion of that thoracic spine. 3, 2, 1. Relax, holding that flexion. Okay, 3, 2, 1. Pushing down with your hands. Trying to increase that flexion of your thoracic spine. 3, 2, 1. Relax. And last contraction here. I'll count you in. 3, 2, 1. Pushing down. 5, 4, 3, 2, 1, and relax. Great, slowly coming out of that base. Okay, the last is our spinal segmentation work. This is going to give our nervous system that information of that new space that we've just opened up, and we're trying to get individual control of each and every vertebra. So slow and controlled, you don't have to go with my pace. Try and do 6 to 8 reps here. So let's first of all get into extension. Forward onto your blocks. We want to extend into anterior pelvic tilt, chest up, sternum up towards the ceiling, looking up as far as you can. Now initiating from your lower back into posterior pelvic tilt, slow and controlled. Then what we do is we start to come up into that thoracic spine, and we're bringing our sternum to our belly button. So we don't want to create this movement from our shoulder blades, looking down now towards the floor. Okay, initiating from our lower back into extension, anterior pelvic tilt. Now we go to our thoracic spine. We're lifting our sternum and chest forward up towards the ceiling and squeezing out that extension. Great, initiating from the lower back into flexion, posterior pelvic tilt, coming up into our thoracic spine, bringing our sternum towards our belly button, looking down towards the floor. holding. Okay, initiating from our lower back into extension. Chest up, sternum towards the ceiling, extending our thoracic spine up towards the ceiling, holding, initiating from the lower back into flexion. Thoracic spine, sternum to our belly button, looking down. Okay, 2 more sets. We start going into extension. Chest up, looking up towards the ceiling. Good, initiating from the lower back, really slow and controlled, searching for that movement, that individual control. Flexion, extension. Good, and back into extension. Great, and looking up towards the ceiling. And slowly come out. Gee, it's amazing how good you feel after doing some spinal segmentation work and some PAILs and rails. So really important, this is the foundation of your spinal health. So get into it, build the intensity up over time, but start gently.